Hello everyone, welcome to the YouTube channel of Chameli Devi Institute of Pharmacy, Indore. In this session, we will going to discuss about hospital pharmacy part 1. So, before moving ahead, I just would like to mention content of the session. Then there is a definition part which is having hospital and hospital pharmacy. Then functions of hospital pharmacy, objectives of hospital pharmacy, then services of pharmaceuticals or hospital pharmacy provides. After that, role and responsibilities of hospital pharmacist, then location of hospital pharmacy, where the pharmacy is located in the hospital, then layout of the hospital pharmacy, how the hospital pharmacy will assist. Basically, hospital is a healthcare unit which incorporates a combination of specialized scientific equipment and functioning through trained and certified healthcare professionals working as a team for common purpose of providing medical services to the population. So, hospital is a healthcare unit which is having scientific equipments, and for their functioning they have team of professionals and trained and certified healthcare persons. Their object is to providing medical services to the patient or population. Now, what is hospital pharmacy? So, it is a department, service or a domain in the hospital organization managed under the direction of a professionally competent, legally qualified pharmacist. So basically, the practice of pharmacy within the hospital under the supervision of a professional pharmacist is known as hospital pharmacy. Now, functions of hospital pharmacy. So, hospital pharmacy having various kind of functions. They can forecast of demand, selection of reliable suppliers, prescribing specifications of the required medicament, manufacturing of various kind of sterile and non-sterile preparation, maintenance of manufacturing records, quality control of purchased or manufactured product, distribution of medicaments in the wards, dispensing of medicaments to outpatients as well, drug information sources in hospital, then Center for Drug Utilization Study, implement the recommendation of the pharmacy and therapeutic committee, patient counseling, and maintaining bridge between medical, nursing, and the patient. So, some functions I have mentioned in the structure from that, which is medicine management, then technical services provided by a hospital pharmacy, as well as supply of medicines and their dispensing indoor or outdoor to the patient, and quality assurance of manufactured medicines, and information technology regarding the medical things. So there are some objectives of hospital pharmacy, in which includes their goal is selection, prescription, procreation, delivery of medicines, administration, and review of medications to optimize patient outcomes, as well as they can ensure that the right patient, their dose, route of administration, time, and drug, and information about medication and documentation are respected when any medication is used. So this is the objective of the hospital pharmacy. So, pharmaceutical services in a hospital comprises of the services rendered to the patient through a number of activities like dispensing of drugs, management of the store, which includes various activities in which purchase of drugs as per their accommodation of the pharmacy and therapy committee, then providing instructions for proper storage of such kind of drugs and maintenance of proper record of the drugs purchased and their distribution. So these all three categories are involved in the management of the store. Now, manufacturing and distribution of medicaments is one of the service provided by pharmaceutical department. After that, they providing the therapeutic drug monitoring services, the establishment and maintenance of the drug information center, patient counseling services, maintaining bridge between medical staff, nursing staff and patient themselves, and to maintain the nursing department and the central sterile supply unit in the hospital. So, what are the roles and responsibilities of hospital pharmacist? Hospital pharmacists played an important role in our hospitals. They have played their role and responsibilities with indoor patients as well as outdoor patients. So, if we are talking about indoor pharmacist responsibilities, then it involves 4 points, which is central dispensing area, patient care areas, direct patient areas, and general responsibilities. In the first point, central dispensing area, pharmacist ensures that all drugs are stored and dispensed correctly. They check the accuracy of the dosage prepared. They maintain proper record. They prepare bills, coordinate overall pharmaceutical needs of patient. Framed policies and procedures are followed. They maintain professional competence and communicate with all pharmacy staff. Next point is patient care areas. So, in this area, role of pharmacist is maintain bridge between nursing staff and medical staff, reviewing of drug administration, provide instruction and assistance to the junior pharmacist. In the third area, which is direct patient area, pharmacists play a role as a identification of drug brought into the hospital, obtaining patients' medication history, assist in the selection of drug product, monitor patients' total drug therapy, counseling patients, participating in cardiopulmonary emergencies. Last point is general responsibilities. So, general responsibilities of pharmacists is ensure that all drugs are handled properly and participate in cardiopulmonary emergencies. The role of or responsibilities of pharmacist in outdoor patients would be central dispensing area, patient care area, and as well as general responsibilities. So, in the central dispensing areas, pharmacist ensures that proper techniques are used in ex extemporaneous compounding, provides for adequate record keeping and billing, correctly maintaining prescription files, keep the outdoor pharmacy in a neat and tidy manner. Second point is patient care area. In this area, their role is to periodically inspect the medical area to identify drugs bought by patient to clinic and record the patient's medication history, monitoring of drugs, and to counsel the patient on the proper use of their medication. Last point is general responsibilities of pharmacists in outdoor concern. So, in this area, their role is to coordinate overall needs of the outdoor services area and exercise control over such drugs. They ensure that all drugs are handled properly, such as storage of investigational drugs, to participate in cardiopulmonary emergencies, and provide for in-service education and training for pharmacists and pharmacy items. Now, what is the process for patients, outpatients? So, when prescription is written by doctor, then it will be received by pharmacist, and pharmacist will fill prescription in the terms of their selection, labeling and pricing. After that, they dispense it to the patient. Medications will be dispensed. Then, in the terms of billing, receipt of payment will be in the free cash or will be charged. Their statistics and reports are recorded. If we are talking about prescription filed, then if a prescription in a regular manner, then it will file in a regular prescription file. If there is a narcotic drugs are involved in the prescription, then it will be recorded in the narcotic prescription file. If we are talking about process for inpatients, then prescription is written by doctor, pharmacy or the nurses. So when doctor is written the prescription, then it will received by the pharmacist. Then pharmacist will fill the prescription in the terms of their selection, labeling and pricing. Then they will dispense the medication to the patient, and it can be free of cost, can be in the cash or can be in the credit. Their statistics and control would be recorded. If prescription is written by pharmacist or by pharmacy, so there is a returns to the credit, and credit issue would be in the terms of selection, labeling and pricing, and their statistics and controls will be recorded. If prescription is copied by nurse, then it is medication in the order. After that, it is received by pharmacist. Pharmacist will filling the order in the terms of selection, labeling and pricing. Then they dispense that order and give charges about that, and their statistics and controls will be recorded. Location of hospital pharmacy. Hospital pharmacy is located in a hospital premises so that patient and staff can easily approach it. It is in multi-store building of a hospital. The pharmacy should be preferably located on a ground floor, especially the dispensing unit. It should be laid in such a way that there is a continuous flow of man and materials, so the process would be easy. So this is the layout of hospital pharmacy. There is aseptic area, manufacturing section, raw material, stores, finished products, passage, administrative section, and dispensing and open space. So the aseptic area is used to prevent contamination of an object by microorganisms. This is extremely important in preparing all IV medications. When manufacturing section is for the manufacturing of medications, the raw material store is for the materials which is stored in these sections, and passage after that administrative section, dispensing in open space. So in hospital premises, patient and staff can easily approach it. In multi-store building on the ground floor, especially the dispensing unit, the manufacturing room should be adjacent to the pharmacy. Outpatient pharmacy should give pleasant appearance and must be enough space for sitting of patients who have to wait for medicines. Medical stores or pharmacies should be adjacent to the pharmacy itself or should be directly connected to the pharmacy. Thank you everyone for watching this session.